Hi, everyone, and welcome to Doc's Thoughts. I'm going to spend some time today talking about alternative healers. So for those of you who know me, you know that part of my transition into integrative medicine was I was seeking out alternative therapies on my own. So I was really, deeply embedded in the Western medical system. I was a Western medical doctor working in the emergency room, but I was having some personal health issues, and I was not getting what I needed in Western medicine. So I went outside of the box and I started to see alternative healers. I started to use nutrition and lifestyle changes, and it was all these things that it was like a light bulb went off in my head, or I always say the smoke was rubbed from my eyes, and once you see it, you can never go back. I went back to my Western medical practice and I was like, why are we not telling people about these things? Why are we not helping our patients with all these other things that are available? And that's a whole nother story. There's multiple reasons why we're not doing that in Western medicine. And one of the things is just the constraints of time. But basically, I decided to go out and learn that on my own and then bring that to my patients and really develop a practice centered around that. And it's been amazing. One of the things, however, I have found is that patients are really struggling. And so a lot of us are seeking for care outside of Western medicine. We are going to different alternative healers, functional medicine doctors, integrative doctors, chiropractors. I could just go on and on. There are so many different types of alternative healers out there. And so many of them are doing a wonderful job. I utilize them myself, but there are definitely some bad players, and I call them the charlatans. And what happens is, these people get into this business and they realize they can make a lot of money because people are really desperate and really need healthcare. And I see people spending $5,000 to $10,000 to $15,000 to $20,000 a year for their alternative healthcare when they did not need to spend that much. They could have gotten from point A to point B using alternative therapies without just literally wasting or getting rid of their life savings. I see it all the time. And so I really feel like it's important to talk about that. So I want to share with you a couple of things you should look for when seeking alternative therapies or therapists, and what might be the red flags that should maybe direct you to go somewhere else. And so that's where I'm going to talk about from now on. So first thing to talk about is, has that provider looked at the obvious first? So in medical school, we were taught to don't search for the zebras first, look for the regular horses. So has that person looked at the obvious, checked your vitamin D level, checked basic labs, looked for a thyroid problem? So if someone is already going towards the really out there stuff and they haven't looked at the regular stuff that's pretty obvious, I would say that's a red flag. So you want to work with someone that looks at the whole picture, not just the really out there stuff. Second of all, do they accept Western medicine? So a lot of us are super turned off by Western medicine, and I totally get it. But I also have so many friends and family members who have needed Western medicine. It's a very important part of medicine, and it's foundational. You cannot dismiss Western medicine. And so if you go to a practitioner that says, nope, Western medicine is totally whack, you should only do my alternative therapies, I think that is a huge red flag. And I would try to look for someone who's more comprehensive, holistic, integrative, and is willing to accept both worlds and maybe lead you in that area outside of Western medicine, but doesn't reject it completely. Third thing to watch out for is, how often is this person making you come back? So when I first see a patient, I make them come back right away for a follow-up as soon as we have all the information gathered that they needed to do. So sometimes, I'll send them out to do labs or whatever, or I'll have them make some changes. And then I have them come back in an appropriate amount of time to assess the situation. How did you do? What are your problems? What are your lab results? And we go over them. The goal with each patient, however, is that each time they come to see me, the length gets longer and longer, because you should be the captain of your own ship. You should have the reins for your health in your own hands. And if someone is making you feel dependent on them, whether it's for a prescription drug or recurrent testing, supplement changes, that is a big red flag. So it's hard to kind of figure out, because you might need to go a lot, even for that first year or 2 years. If you're super sick, you might need to go very often, and that's okay. But if you get to the point where you're like, I'm feeling pretty good, I think I have this under control, you shouldn't need to be seeing that practitioner every 3 months. Every 6 months to 12 months is probably fine. With that being said, if your alternative healer is a body worker, like a massage therapist or a Reiki practitioner or an acupuncturist, you might need to see them regularly and definitely. So people who do body work, I see body workers myself, love them, but that's more of a regular practice where you go in and you kind of get a tune-up. It's almost like an oil change, and that's something that usually you need to see them more frequently. But watch out for the practitioners who aren't doing body work, who are making you come in really frequently to get your refills of whatever they have you on. And that kind of feeds into lab testing and supplements. So there are basic labs, which are blood tests that you get like at a traditional doctor at the hospital. And then there are alternative lab tests. I call them functional medicine labs. I use them all the time. They're usually kits that you bring home. You collect the sample yourself and you send them into a company. A lot of these are actually available to the trade. You can buy them online like Everlywell. So I do use them all the time. So there's nothing wrong with your practitioner using those. However, if they are ordering them almost like excessively. So if, for an example, there's people who have to do food sensitivity tests every 3 months and they do it every 3 months and there's never an end in sight, that's a problem, because usually the practitioner is making a profit off of those lab kits and you're probably not going to change your treatment that much every 3 months. So that's probably a little excessive, similar to hormone testing. If you're taking hormone replacement therapy, which is really powerful, hormone testing, I think, is also very useful. I do it all the time, but it shouldn't be something that you have to do every 3 or 6 months once you're stable, especially if you're stable. So if you're a postmenopausal woman and your hormones are very stable and nothing else is changing in your life, you shouldn't need to be testing over and over and over again. That strikes a red flag that maybe there's some profit going on there rather than actually good patient care. And then that ties into supplements. So supplements are basically vitamins, nutraceuticals, things that you take that are not prescription medications. They're very important. I recommend them all the time. However, if your practitioner is recommending just a crazy amount of supplements, especially if they private label them, meaning their name is on the supplement, so they're making money directly off that supplement, and they're changing them every 3 months when they make you come in every 3 months and you look at your drawer and you've got like 30 supplements in there, huge problem. Like none of us need to be on that many supplements unless you are really, really, really sick. And then you should only need to be on them for a short period of time as you are getting healed by that practitioner. Does that make sense? So really watch out for that. Again, there's a gray area. I recommend supplements. I make a small profit on them. I don't private label them. But if it gets to be too far over where people are making a ton of money and they're just putting you on a ton of supplements, I would just be a little bit cautious with that. And then the last couple of things I would look at, which I think are really, really important, is, look at that practitioner and look at their life and look at their energy and ask yourself, is this someone I would want to be like? Now, this is, again, hard because, you might be seeing a specialist like a cardiologist or a GI doctor, and it really doesn't matter what kind of lifestyle they live because you just need their expertise in that specialty. But if you're seeing a wellness person, someone who is your mentor, your advocate, trying to make you healthier, change your lifestyle, they're trying to almost be a coach for you, ask yourself, are they doing what I should be doing? And if not, that might not be the right fit for you. And I'm just going to tell you, there's not one person or practitioner that I'm talking about in this video. I'm looking at themes and I'm looking at some of the things that patients are bringing to me when they come in to see me for consultations, and some of the things that I'm just not feeling really good about. I feel a little yucky about it. So I want to educate you on things that you can do yourself, because again, a lot of us are seeking treatment outside of Western medicine, and in any industry, you have to be careful that you're not getting taken advantage of. But there's not one practitioner that I'm thinking about in particular, especially not in my area. And then I think there's one other thing I was going to talk about. So again, I think goes back to the ego thing. So if that practitioner is like, I can do it all. Like, I've heard of chiropractors basically saying that they are going to take care of your overall health and wellness. They'll treat your blood pressure. They'll get rid of your ear infections. And I'm not picking on chiropractors. I love chiropractors, but I've heard of specific chiropractors doing that. That is a huge red flag. Like, you would never come to me and expect that I'm going to take care of a blocked coronary artery. No, like, that's ridiculous. You would never go to your gynecologist and expect that they're going to take care of your colon polyp, right? And get rid of polyps in your colon. You should never go to an energy healer who says that, oh, you don't need to see any other doctors. I've got you covered. Just do what I tell you to do and buy what I want you to buy. Huge red flag. So as you guys can see, this is all totally common sense, but I've been in that seat where I was desperate and I just needed someone to care for me, and I wasn't finding it in my traditional medical world. And so I've been there. I get it. And I see it in my patients all the time. And so I just want to make sure that you guys understand that. And as you're moving forward, just really take a step back, go through all those check boxes that I just talked about. Ask yourself, is this person, really giving me health care and wellness care? Or am I in a pyramid scheme, or are they just lining their pockets with money? And that's all you got to do. And then you'll know intuition is really strong, and you'll get where you need to go. And I hope and wish for you guys all optimum health and wellness. Keep fighting the good fight. Healthcare will change. It has to. And we will all come together as a team and create a beautiful system that we can help each other with. So with that being said, I'll talk to you guys soon, and thanks for tuning in.